Hello guys, this video is about my pregnancy and delivery experience in Canada, my childbirth experience in Canada versus Dubai. Hello guys, welcome to my channel Travel with Sophia Zib, where I post about Canadian immigration and our daily vlogs about our Canadian life. This vlog is about my child birth experience in Canada with my third child. We just had our third baby, and thank you very much for all your wishes. I delivered two of my babies in Dubai. And the third one in Canada. So a lot of you have requested to make a video on this topic, how the child birth experience was in Canada as compared to Dubai. So I'm making this video, so stay tuned. Okay, so the process, how it went, it was I wouldn't say it was a smooth process, but then it wasn't a difficult one either. You just have to adjust to the system. Yes, the system is there are it's funded, it's totally funded by the government. I'll tell you the steps, I'll take you through the steps and take you through the different policies and procedures, how it went through, and and how it is different from Dubai. Like when we came to know that when I came to know that I'm pregnant, I went to my family doctor. You have to enroll to a family doctor. You have to register yourself and your family with this doctor, like with a doctor in your neighborhood. He is going to be your family physician, your pediatrician, your go-to for every medical need. And then if that doctor feels the need that he cannot, if it's a specialized thing, then he will refer you to a specialist or consultant further. But it has to be something which he cannot diagnose or he cannot treat. So for every common cold, flu, for even your diabetic or hypertensive or thyroid medication, he is going to be your channel. Like he's going to be your go-to person for all your medical necessities, for all your medical needs, diagnosis and treatment. First and foremost thing, when I came to know that I'm pregnant, I went to my family doctor. He requested for a urine pregnancy test there and then, which came positive. And so that's the first step, that you come to know that you're pregnant. Now to see if that pregnancy is viable or not, like after the urine pregnancy test came positive, he sent me for an ultrasound and a blood work. He did the blood work there and then. So I went for the ultrasound. Then the ultrasound report came back. Then I was going to this family doctor for follow-ups up till 22 weeks. I was going to him. Okay, so up till 22 weeks, he was the one I was going to for all my for all the blood tests. He called me after every month, and even sometimes he did not call me, so I had to go to him after a month. He will call you after every month to check your blood work, to check your iron levels, to check your vitamin D levels, or whatever he feels necessary. And he will start from the day you come to know that you're pregnant. You will be started on prenatal vitamins, which are naturally there is a problem of halal and non-halal prenatals, so you have to take care of that. So he prescribed some prenatals at the pharmacy, which I did not take, and then I researched the halal medicines, and I started taking that. Every month I used to go to him for a follow-up visit. For he used to check my iron levels or sugar levels or whatever, blood work he needs, he wanted to get done. So I used to check my BP and all that different things. And from at 22 weeks, a little before 22 weeks, they asked me which hospital would I prefer, and I asked for their suggestion, and their suggestion was Trillium Hospital, which I had gone to Trillium for my emergency problem, like, some time back, and I was not very much like, comfortable with Trillium, because the emergency line was so, like, it was so long that I had to wait for an entire night in the emergency department. So I knew that it's a decades old hospital with a lot of patients. So I did not prefer that. Whereas my friend had recently delivered at Credit Valley, and she had a very good, she held a very good opinion about Credit Valley. So I immediately told him to refer me to Credit Valley, which they resisted a bit, but then they had to agree, because I told him that, I want at Credit Valley. So you have to be a bit of, like, you have to be after them. um, Considering that the government is funding everything, like, all these visits, all these checkups were free up till now. So the my family doctor had already arranged my first visit with the gynae ops clinic at Credit Valley, and when I went there for my first visit, they immediately scheduled my next visit without me telling them, and they, like, they just booked an appointment after 1 month. So it's like on every visit they give you the visit, and the next visit's appointment. Now, coming back to Credit Valley, from 22 weeks, I had started off my visits with the gynae ops at Credit Valley. Now, there is a separate polyclinic type, like, there is a separate building. Now I went to this gynae and ops, and what happens at Credit Valley, there was a set of doctors. There was a group of doctors, and they had 8 doctors on the panel, and on every visit there was a separate doctor seeing me. They were carrying my file, and whatever issues I had, I usually, discussed it with them, with each and every doctor, and asked them to do my blood work, or if they, whatever was in the routine, they used to prescribe that for me. So that was not an issue at all, because all the doctors are well informed. They are experts in their fields. So I had no, and they are extremely friendly, and and very friendly, and they will solve your problems. Whatever questions you have, they will solve that. So I had not I didn't have a problem with that, but the only concern was there was no ultrasound facility, and the ultrasound was not done on every visit every month. They just heard the, like, they just checked the fetal heart sounds, they checked me manually, they checked the blood pressure, and that's it. This was the like, this was my checkup done at the every month at their clinic. This was my general ward, which had 2 beds, 2 patients in one room, and for which I had paid nothing. Like, it was all covered by OHIP, the government funding. We asked for a private room, but we had to pay around $260 to $300 per night for a private room. So it was of no use, because my husband was sleeping at home with the other 2 kids. So, just for me, it was okay. So I was quite comfortable in that general ward. After delivery, my baby was kept in the peds department. She was sent to the peds department because she had a little bit of jaundice, at borderline. That's why they had to admit her. And this was a play area where my other 2 kids used to play during the daytime when they came to meet me. One more thing which was different from Dubai was that I remember in my first pregnancy, I was not very much comfortable with my first gynac, because obviously it was my first experience of being pregnant in Dubai. So, like, I was not comfortable with that gynac. So I had to change my doctor. So I just called and took up an appointment from another hospital, and I just got that appointment. Whereas here, it's not easy to change your doctor. Then again, you have to get a referral from your family doctor, and they will not do it. Once you get an appointment with one of the hospitals and one of the doctors, it's very difficult to go back again, because usually the appointments take a lot of time. So once you get the appointment with one doctor, it's there is no reason why you should be changing that doctor. So, as I already told you, that there was no ultrasound on every monthly visit to the gynec clinic, and for the routine ultrasounds, which were like twice or thrice during my whole pregnancy, they used to send me to Dynacare, another lab, which was the facility was in the same building, but I had to take appointment, and that was a separate appointment that I had to take for that ultrasound and come again for that. Another major difference was that in Dubai, when I had like any problem during my pregnancy, during my last trimester, that is reduced fetal movements or abdominal pains or anything, I like you go to your gynae ops immediately, and there she does an ultrasound, she checks for your fetal heart rate, and everything is solved. But here, whenever I had a problem like this one, I was sent, although I had an appointment with the gynae ops clinic, but I was sent to the labor and assessment unit in to the Credit Valley main hospital. So it was a run here and there, which I did not like at all. I usually prefer going to one gynae ops, like clinic or hospital. Like I want one channel for all my problems, which was there in Dubai and not here. Another major difference was that in Dubai we had to pay. We had like I had a C-section, so my company was giving me medical insurance, which was around 10,000. The limit was 10,000, and C-section costed us around 25,000. So we paid around 15,000 dirhams from our pocket on top of that 10,000, which was paid by my company insurance. Whereas here in Canada, we paid nothing, and literally nothing. We paid except for the medicines that we had to take during the stay or at the time of discharge. After treating her jaundice for 2 days, she was quite normal, mashallah. And so we were discharged, and we were told to take the follow up visit at the family doctor. And now her vaccination and everything will be continued with her family doctor. And so we came home after that.